Aloha.
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 Shaka Mahalo, brothers.
Okay,
So I'll start. My article that I picked was on lower back pain and associated presenteeism among hospital nursing staff. So presenteeism is a concept used to designate the phenomenon of people despite complaints and ill health that should promote rest and absence from work or still turning up to their jobs. And so lower back pain is just like one of those examples that nurses on a daily basis struggle with, but still go to work. The article was published in 2013, and it assessed the risk of presenteeism specifically due to lower back pain in nursing staff. It took place, the survey was on 174 female nursing staff, and it was from 4 different small hospitals. They assessed it based on a questionnaire, and in the results it was found that almost 60% of the workers suffered from lower back pain, and they went to work at least one day during the previous year despite their lower back symptoms. The other thing that I found what was interesting was that registered nurses had a higher outcome of that compared to nursing aides, because they kind of feel that they have a duty to be there for their patients, whereas nursing aides don't have that job satisfaction, so they don't push themselves as much, I guess. Most of the personnel were an average of 42 years old and had like 16 years of job experience, so they were in the workforce longer. I think that's about it.
So we're saving questions till end, right?
Yeah, let's take questions till the end.
Okay, so my article is called Presenteeism and Musculoskeletal Symptoms Among Nursing Professionals. This, again, of course, is a quantitative article, and its significance is that it found that 74.9 nursing professionals experienced presenteeism, and 71.6 reported lower back pain as that, so specifically lower back pain that caused the presenteeism. This was taken, it was a longitudinal study, and it was taken, there were 2 stages of surveys, and the people, so the objective was to collect information, the study, let me see, so the demographics of the people. So the demographic characteristics of the sample, they reflected nursing professionals with an 84.6 prevalence in women. Mean age was around 42 years old. And so my article actually found the opposite of lower back pain than Julie's. So the studies show a higher prevalence of symptoms among nursing assistants, and it states since these professionals perform several procedures such as lifting weight, moving and cleaning patients, changing and organizing beds, and other tasks that lead to these musculoskeletal symptoms. And then of these musculoskeletal systems, the surveys identified, like I said, that it was lower back pain that was most frequently reported. And then the study also identified that this lower back pain can cause presenteeism. And so in conclusion, that's the conclusion. And then criticism is just the limitations of the survey, because it can lead to bias and possible interference with uncontrolled factors. And then just future studies on the subject, and of course its repercussion on nursing professionals are needed. Questions?
Yeah.
Okay.
That's interesting, you guys flip-flop.
Yeah.
Yeah, that's kind of cool to have some broad spectrum data.
Did they?
Same way.
Write that down.
Right,
Yeah,
right
Write
down.
that
Sit
down.
down.
Alright, well, my article is titled Disability Symptoms Among Professionally Active Nurses Caused by Back Pain. So, first things first, the study aims to assess spinal pain and its relation to like activities of daily life for these nurses in the workplace. One thing that kind of differs, because I wasn't sure if we were focusing solely on low back pain or not, mine actually assesses thoracic, cervical, and lumbar, but it does differentiate them. So if you want me to focus in on low back pain, I can with this study, or I can just do back pain in general. I have options.
We'll get back to that.
Exactly. They did a study of 100 workers, and they accounted for many variables, such as age, place of residency, education, number of years in the workplace, different wards, and whether they're like a one-shift worker or they work multiple shifts. And then, let's see here, they assess back pain using an Oswestry scale, which conveniently enough I've used on patients before, back in PT. So I'm not a credible source, but I can assure you it's a reliable tool that medical professionals use. And then the other thing they did, which kind of ties it all in, is they did a little survey saying, like, to these nurses, you know, if their back pain places no restrictions, slight restrictions, moderate restrictions, or serious restrictions on their work. It is predominantly the lower back pain. It says nearly 70% is the lumbosacral region, so it does tie into our specifics. It did show there's a strong correlation between number of years worked. I think it was nurses with seniority over 21 years had experienced a higher range of pain intensity, which makes sense. You know, if we're constantly putting stress on our backs, you know, we're going to have more pain the more we do the job. And that's what's kind of good in our studies, if we can start eliminating this early on, so like maybe even for nursing students or new grads, and start implementing these good techniques that maybe you guys will talk about. We'll show it more later on in our lives. Other than that, yeah, just the work experience. Nurses. I think that's pretty much it. I can of course go into like specifics on numbers if you guys want, but
Just give
Sure.
us like a.
yeah. All right. Let's see here, because there's a lot on here. Okay, so I said 70% say that it affects their work, and then also 90% indicate they believe it's caused by their work. They believe it's caused by an overload in their work. So even just there, it's, you know, it's like correlation. I feel like because it is kind of stereotype in nursing, like we do believe like, yeah, it's caused back pain, and we make jokes about it and everything, but it is a serious issue at the same time. Let's see here. The back pain was higher prevalence in the women of the study versus the men. And they do this point system that I kind of have to read deeper into. I think it's, no, because part of the restrictions, so I need to read deeper into that. But that's how they scale it with the restrictions, like moderate or serious. You can see how they do their math. Only 4 women marked 0. also
Younger.
younger and did not have, they had less experience in the workplace, so probably just not coming on yet.
Cool. Mahalo for that,
Oh,
Riley.
mahalo.
Okay, so my research article is called "The Effectiveness of a Patient Handling Education Program for Nursing Assistants as Taught by Physical Therapy and Nursing Educators." This was done by mostly physical therapists. The study was done by physical therapists at a hospital called Beaumont Hospitals in Michigan.
Beaumont, like Footloose Beaumont?
I guess, I don't know. But, so what they did was they first surveyed all these nursing assistants who worked in these hospitals, and this was a mandatory program at these hospitals, so they have a pretty good sample size. I think it's like 250 nursing assistants who went through this. And they surveyed them just to see how comfortable they were with moving patients, lifting patients, things like that, and how much back pain they had. And in the introduction of the article, it's interesting that they brought up that many nursing assistants don't really have much training at all, and some of them don't have any formal training. It's more just on the job. A nurse will like show them one time how to
Just
do it
like
and
us.
say like, go get them, yeah.
Yeah.
Like, so many of the nursing assistants felt like unsafe to move their patients, but it was part of their job, so they kind of just did it. So it just really kind of showed how unsafe it can be. So they did that survey, and then they implemented an 8-hour training program at the hospital that every nurse assistant had to go through. It was either a 1 8-hour program or broken into 2 4-hour programs where they went over just educational stuff like theoretical how to lift patients, emergency scenarios on how to move people, how to use the lifts, the mechanical devices at the facility, and then they broke up into groups and actually practiced lifting and things like that.
That's good.
Yeah, so it was kind of hands-on as well. I would say probably mostly theoretical, but they also did teach the body mechanics. And it was taught by physical therapists in combination with nurses. So the physical therapist would teach the body mechanics parts, like keep your back straight, keep your feet shoulder width apart or whatever, like that kind of body mechanics stuff. And the nurses would bring the more things that were more relevant to the nursing assistants. So they went through the program, and then they surveyed again to see how they felt after going through this program, if they were more safe. And statistically, their confidence did increase. It wasn't a huge number. It went from, so the stat that it says here is the beginning score of confidence was 39% plus or minus 6%, and it went up to 46% plus or minus 4%. So some like kind of convoluted statistics there. And then their like scores on, it was like a survey of 1 out of 5, strongly agree, strongly disagree about patient safety, generally meaning the higher your score, the more safe you feel lifting your patients. It went from a 4 plus or minus 2.2 to a 7 plus or minus 2.2, so that increased quite a bit more. So the test kind of, this program kind of researched in theory if how implementing a lifting program for these nurse assistants would make them more safe. But it didn't reassess them at a later date to see if there actually was more safety, so that's one con that I have to say with the article. And the article did kind of briefly mention how having this safety would lead to more job satisfaction, it would be a less stressful and more productive work environment, patient safety would be increased, and it did mention how prevalent nurses assistants, or like how often they would miss days of work because of injuries and things like that. So if we're able to reduce those injuries, we can reduce the amount of days that these nurse assistants are missing work, which would like just be better for the unit in general because the nurses wouldn't be overworked and things like that. So that's kind of the gist of my article.
Actually, one more statistic that I remember was in my article that backs up yours is that only 35% of nurses surveyed knew the like norms of lifting and the proper ergonomics of it.
Yeah.
It's cool that they include
And I think you said it was like 39%, so it is kind of around there.
Yeah, it's like way lower than you would
Yeah, it's
think.
like a third of nurses actually know how to and feel confident lifting properly.
Yeah.
It's so funny, because I just kind of take it for granted, but then when I think back, where did I learn how to lift?
Mhm.
You know, I think it's just like layered with just personal
Yeah,
experience, you know?
but not everyone has
But
that.
yeah,
Mhm.
Right,
Yeah,
exactly,
totally.
like I'm taking it for granted.
Mhm. Yeah.
Okay, so my study was also an intervention, and it's titled Effective Transfer, Lifting, and Repositioning Injury Prevention Programs on Musculoskeletal Injury Among Direct Care Workers. So they're defining direct care workers within hospitals as anybody that is directly taking care of the patient. So it included nursing assistants and registered nurses. It was done in Canada, and that's kind of important when I talk about like the intervention group versus the control group. So it was a 2-year-long study using 3 hospitals for the intervention group, a small, a medium, and a large, and that'll be important later in a moment as well. And then there were 3 control hospitals, a small, a medium, and a large. So that's not a lot of hospitals, but there weren't a lot of hospitals in the province in Canada, so that's what they could get, you know? When they were trying to like find hospitals that were similar for an intervention group and a control group. So the authors of this study identified that there have been other studies on this, but they're primarily focused on an education component or like a mechanical lift component, but not both. So the designers of this study wanted to make sure that they were looking at something that they call like multifactorial. So they first made sure that each hospital in the intervention group had 2 lifts per unit. So they spent over $200,000 in getting some of these hospitals up to like baseline in order to participate in the study. Now, that's each hospital got 2. So the large hospital actually had less lifts per bed, right, than the small hospital did. So, because it was just like 2 per unit, and so, you know, that's an issue. And then they did an education component, which was 1 day of mandatory education. Again, this was required of all staff. And then since it was 2 years long, they did like re-education like once a year. So they
for the same duration or?
for 1 day. Yep. And then what else did they have to do? Another aspect of it, so that's the education part. But they cited studies that with just education, you didn't see better safety outcomes for like back pain. And so they did a decision tree that was specific to every single patient that came in, that was put up on like the behind the head of their bed, that told the direct care personnel how that individual patient had to be moved. So if they had to require the mechanical lifts, like that was right there, easy for them to see, and it looked like it was coming from, you know, administration. So they had a lot of buy-in. And then, like I said, they ensured that equipment was available. So with all 3 of those things, we better have some positive outcomes. And there were. Let's see here, the way that they figured how to figure out like, okay, well, how many injuries were there per full-time employee was they looked at full-time equivalents. So there were a lot of part-time employees that were part of this study, but they added up, so like a part-time employee essentially counted as half an employee, and that's how they kind of made it be compared like apples to apples. So they were looking at injuries per full-time equivalent. Let's see here, anybody that had an injury in the same body part, again, those extra injuries were not counted if they were within a certain time frame, because that's just a re-injury from the initial injury. Also, if there were any previous injuries in that body part, then it wasn't counted, so that they weren't saying like, oh, you have a new injury because of this. So I thought that was good. And the injury had to happen during the patient maneuvering itself. So it couldn't be because they were lifting a box, it had to be because they were moving a patient. So they differentiated between that. So in all, the sample size was 1,468 personnel in the control and the intervention groups, and they looked at why these people were having injuries and if it related to like presenteeism or absenteeism. Alright, so then back, neck, and shoulder were the main parts injured. The majority of injured workers were nurses. They did all kinds of statistical analysis on this. They did Poisson regression. Poisson means fish, so I think of it as fish regression. And then they did multivariate Poisson regression, and they found different outcomes between the two. Most importantly was there were significant reductions pre to post period of the interventions for time loss injuries in the intervention group in contrast to non-significant changes in the control group. And where they found the most significance was in the small hospitals. So another thing was that time loss of days of injury and then claim cost per injury were looked at, and it was only the time loss injury that was a major problem. And time loss for them was either being at work and not being productive, presenteeism, or actually just not being at work. They took both of those and just called it time loss. The p-value for that was 0.013, so that's pretty good to like say like this could be, distributed, among a wider swatch. So I think that means it's kind of a good study. So that time loss claim decreased from 35.99 days to 16.2 days. So 55% reduction.
Nice.
Again, like the biggest ones are in the smaller hospitals. And they talk a lot about why that might be. So I want to go there. So in general, like this looked effective. But with the smaller hospitals, it's possible that the differential effect of the intervention may have been due to differences in how the intervention was received, like by the staff. And in the small hospital, a lot more patient lifting equipment per hospital bed was available, right? Because there was only 2 lifts per unit. But if you have like 20 people on your unit versus 35 on your unit, you still don't have enough lifts maybe.
Yeah.
We have 6 minutes left.
Okay, so that was that. I'm done.
Okay.
It's a really good study. Something I would just like to point out that contrasts or both of your conclusions as far as the CNAs, let's see, what was presented, was that the demographic of my study, it showed that it was significantly, the CNAs were being affected with the lower back pain and the presenteeism, and they said that was because of what their job entailed. But then something I would like to point out is that it contrasted both of yours as far as who's really getting injured, but a little over 50% of the study being done on mine was CNAs specifically. specifically, and it was about 24% who were actually RN. So that definitely influences and might not contrast as much as like who's actually getting injured.
Was yours in a hospital or a skilled nursing facility?
It was in a hospital.
Okay.
200 total nursing professionals.
200. And where was it done?
This was in Brazil.
Brazil.
Yes.
Was it only females or males?
It was both, but significantly more females. And I just,
Because mine, it had males, but then they excluded it because it wasn't significant enough. They only had 21. So that was kind of one thing that popped into my head was
Yeah, I was
it
gonna
might
ask.
not be fully representative of the population. Yeah, but they just said male nurses were excluded because of their small number. There were only 21.
That's interesting.
Yeah, mine had a pretty small sample size of males as well.
Mine did too, but I mean,
That was
that
really
just might be the way it
But it has
goes.
to do with the profession.
But we
Yeah.
kept ours in. Hey, so where was your study done?
It was done on the East Coast.
Okay, so here in the United States.
Yes, it's called Piedmont.
Okay. I thought that was in Italy, but that's cool. How
And
many
they were
jobs did I have?
small.
They were small hospitals?
Small hospitals.
Okay.
Yeah, mine was literally 17% were men. So a lot of women.
But they said that registered nurses showed higher percentage because less ease of replacement and working during non-standard hours. And that they just have that more job satisfaction and meaning of their work where nursing aides don't necessarily.
Yeah.
So they push themselves more.
Right.
And
Yeah.
then they also have that team collaboration where they don't wanna let their team members down, so they kind
Yeah.
of carry that burden.
That was one of the
That's an
things
interesting
that my article brought up as well, is that the turnover rate for the nursing assistants was so high because of the like low job satisfaction associated with the injuries and things like that compared to nurses, because it's more of like an entry level job that you're trying to get in and get out of. So one of the goals was to retain nursing assistants longer.
So what are some limitations, briefly, that you found in each of our articles?
Well, in mine it was a survey, so there's definitely limitations. Just the fact that it was taken by a survey, and the human limitations that lead to bias and just other like uncontrolled factors that we don't know about. So, yeah.
Yeah. I guess if anything, since this is technically a quantitative study for mine, but it only has a group of 100 sample size, it's like that could kind of lead to some bias. But I think that just kind of goes with our topic. And we could probably find articles that have like broader, more like, surveyed multiple hospitals and 1,000, but mine's just based off like 2 different hospitals in Poland.
Poland. Okay.
Coming from all over the world here.
We have a global issue on our hands.
There's a global
Man.
issue, yeah. Do you have any limitations on your study?
Yeah, for sure. So I think one thing that my study didn't do that yours seemed like it did do well was it followed up with the subjects on a later date to see how their implementation actually affected the outcome. So a couple of the notes I made were that it would be nice if they did like a 1-year competency check to see if they still felt confident lifting their patients a year later, as well as maybe study the statistics of how much back pain or back injuries had increased or decreased or so have you
Yeah.
through that.
We're gonna have to stop, unfortunately.
Okay.
It's okay, that was a good
Let's go
conversation.
Do we have anything to wrap up? Do we have anything?
Well, I mean, mine had a lot of limitations. They were really good at describing what those limitations were. I thought that was really cool, like you write a research article, and then the last bit is all about breaking apart your research and showing where all your limitations are. They were significant. So like, the control group didn't offer as much data at all in demographics and in like full-time employment status and stuff like that as the interventional group did. And that was an issue for sure. I think it is important that we list some of the limitations because I think that that she's gonna want to see that.
Yeah.
So also, they used administrative data, not surveys. And so they saw that as a limitation. It lacked information on the subject's detailed demographic and injury characteristics and the total number employed at the site. They also said that they wanted, the measurement time span, it wasn't able to capture fully matured, claims, which is funny, cause mine was 2 years long, so they wanted it to be even longer,
Yeah.
you know? So, anyway, those were a couple big ones.
Cool.
Alright, good job, guys.
Good job.
I'm gonna catch some waves.
Let's go to the beach.
Back to Santa Barbara.